Hello. Okay. Jayesh bhai, I hope I'm audible.
Yes, Parag bhai, you are audible. Audible.
Thank you. Thank you.
So we will start in a minute or so. Dinesh bhai, hope you are recording this session.
Hello. Yes, Dr. Jayesh Solanki.
Hello.
Good evening, sir. Nice to see both my.
Please start the
Yes.
webinar.
Good evening, everyone. So, as every year, that ICMR is starting ICMR short-term studentship, and since last 2 years, there are certain changes in ICMR STS. So today we have with us, we have our additional director, Dr. Jasmin Diwan, sir, and we have an eminent two speaker, Dr. Jayesh Solanki and Dr. Parag Chavda. So first, I will request Dr. Jasmin Diwan, sir, to have a few words and blessings to start the session. And then we have two resource person, Dr. Jayesh and Dr. Parag. One will be discussing regarding the procedure, how you will go to the website, how you will log in, and how what are the different documents required. And Dr. Parag will be discussing regarding how you should do framing of your project. So what are the do's and don'ts so that your project get accepted? So without much time, I request Jasmine sir to say a few words, and then we will start the session. Over to Jasmine sir.
Thank you, Dr. Chinmay, and I congratulate Prime Initiative regarding this short-term studentship projects from ICMR. I am thankful to Dr. Jayesh Solanki and Dr. Parag Chavda to take the lead for this studentship projects. Every year, we are organizing this seminar for the students to help the undergraduate students regarding how to fill up the form, how to uh, select the topic, and how to proceed. So all these are very nicely explained in this seminar. So I request all the students, undergraduate students, my dear students, to please take note all whatever is discussed in this seminar so that it will be very helpful to you for your future projects that you are going to take place. It will not only help you in your short-term studentship project, but it will also help you in your future if you are conducting any kind of research or when you go to your postgraduate studies. At that time also, this all research methodology and how to select the topics that will help. Okay, thank you. Please, Dr. Chinmay, please go ahead. Dr. Chinmay,
Yes, yes.
yes,
Thank you very
please
much, sir,
continue.
for your presence. It means a lot to us. Over to Dr. Jayesh, and then once Dr. Jayesh completed his session, then to Dr. Parag, and we will have a question answer session at the end. I request students to put their question in the chat box so that there is no chaos. Over to Dr. Jayesh. Please start.
Thank you, Jasmine sir. Thank you, Chinmay sir. Is my PPT visible, Dr. Parag? Yes.
Yes, but put it on the slideshow mode. It is on the.
Okay. Thank you, sir. So, thankful to both the gurus of mine and Dr. Parag, and welcome to all those who have joined here. So, we'll be just giving a sort of sensitization about how we can proceed with ICMR STS. Okay, so it is same as 2024. So I'm just written the same, but all the do's and don'ts you will learn from here. Previously, it was from the ICMR website. So it was very easy. But since 2024, it is now shifted from the ICMR website to the DHR website. So I will try to first tell about how to proceed. And the second part is how to make proposal that will be taken by Dr. Parag. So STS is a paperless online program which is since 1979. The aim of this was to promote interest and aptitude for research among medical undergraduates. And the main objective for this program is to provide an opportunity to the undergraduate medical or dental students to familiarize themselves with research methodology and techniques by being associated for a short duration with their seniors on ongoing research program or by undertaking independent projects. So these are the basics you Just focus on this. The student, it can be any student from MCI recognized college. Guide must be full-time faculty with few exclusions. Topic should not be clinical trial. The norm is one student can work under one guide and under one topic. If there is duplicacy, then the proposal will be cancelled. Can you change the guide? Answer is yes. If your guide is not available after the project is being selected, it should be from the same department. And the step should be this. First, you make a research plan or proposal, then get approval from the ethical committee, and then you do the project. The facility and the cost should be borne by institution or your college. And before you fill everything, keep all details ready. Last year it was 30 June, this year it is 31st May. So you should keep it ready before 31st May. This is how it goes. It starts with research proposal. So proposal is your blueprint or plan. Okay, what you want to do. Then you will apply. It may be a selected proposal. Once selected, you start your work, taking all the data and everything. So that will become research project work. And then you summarize everything and come up with result. That will be report. And that report you have to once again submit in soft copy, and that can be approved by the ICMR. So this is what I infer to as 4 P's of research. First P is proposal, your plan, what you want to do. Second is project. You perform the data collection and all those things, either STS or extramural. But remember, your work does not finish after proposal and project. Third thing is presentation. Present your work in paper or poster or any conference. And yes, fourth step is publication in journal. So the proposal, project, presentation, publication, and these cycles goes on if you want to do further research. Eligibility. So from last year onward, it is first and second professional year MBBS or BDS students studying in NMC or DCI recognized medical or dental college in India before they appear in their 4th professional year. First year students, they have to carry out the work from 1st to 3rd professional years, and the second MBBS students should carry out their work from 2nd to 4th professional. So it will be a 3-year long journey. Students who are holding OCI cards or PIO cards or NRI studying in Indian Medical or Dental College, okay, can also apply. But the copy of those cards must be submitted. And since 2024, 3rd and 4th year, students and interns or PG students are not eligible to apply. Students of paramedical course other than BDS or non-medical cannot apply. Students studying in foreign medical or dental colleges are also not eligible for this program. Okay. So guide. Who can be guide? Only regular full-time faculty members working in the same medical or dental college where the student is enrolled. Only that can act as a guide. The part-time consultant or visiting faculty or residents or tutors or pool officers or PG cannot be. So guide can be assistant professor, associate professor, professor or dean. But below that cadre, it is not accepted. Numbers. So they are giving 2% of the total available medical seat in India, that is 2,000 students per year, out of which 80% for MBBS and 20% for BDS. In between 2-3 years, it was 0 for BDS, but once again, it is now given 20% to BDS students. Okay, and they will be awarded only after the review for this year, 2025. First year and second year students are to participate in the STS, is 2025. And remember, the bottom line is that the acceptance rate is very less than 10%. Okay, so you try to make it best. Selected students will be carrying out the proposed research work during the summer break of 2 months for the 3 consecutive years. So 2 plus 2 plus 2. Okay, so for 2 months summer break and for 3 consecutive years, total 6 months. So this is how the work line will go. So first summer break, that is between first and second MBBS, you make the concept, develop and submit the research concept. That is your research proposal. So first break for the proposal. Then the second summer break between second and third MBBS, you collect the data and make an interim report. And the third summer break between third and fourth professional year, do the analysis and prepare the final report. So first break proposal, second break interim report, and third break final report. Okay. And the total financial support given is a stipend of rupees 60,000. When we started in 2012 also, it was 10,000. Now it is 60,000 with effect from 2024. Okay, for the 6 months of research work along with an e-certificate. And stipend will be given in 3 installments. Okay, so this is how it will be given. First installment, rupees 15,000 at the end of first year of work upon submission and review of the research concept note. That is upon the approval of your proposal. Second installment, once again 15,000, 25% at the end of second year of work upon submission of interim report, which will be having your proposal plus some data collected. Okay. And third and final installment of 50%, that is 30,000 at the end of third year of work upon submission and review of the final report of data preparation and everything. Okay. So 15, 15, 30, this is how it is dispatched. So how the procedure will go? So it is a fully online program. No hard copies will be accepted. Student is required to register and submit the application form and research concept note online as per call, which will be evaluated by the ICMR reviewers. If selected, the student is expected to complete the project in the next 2 years in every summer break as mentioned in the tenure. Okay, and they have to submit the concept note and final report in the given timeline. Student will be awarded third or final installment only if his or her final report is approved. So now on they have given the A, B, C, D, E sort of grades to the report. If the grade is E, then you may not get the stipend. So make your proposal better and report even perfect. The host institute or medical or dental college and the guide must take overall responsibility for the conduct of research project, preparation and submission of the complete report, and the requirement enclosures within the time. The second year data collection report should be verified and reviewed by the guide to continue the project for the third year. Award of STS fellowship will be subject to the technical evaluation by the final report. As I said, they are giving grades A, B, C, D, E. Okay, so that should be kept in mind. Result of only successful candidate will be notified on the DHR ICMR websites. If your report is not approved, then you will not get that final fellowship. So once again, the steps should be like this. Registration to be done online. Proposal preparation, work with your guide. Submit the proposal online. Review of application by ICMR. Result declaration by ICMR. And then research and report work you have to do as per STS guideline. And 2 reports, interim and final, you have to submit at the end of second and third year in the prescribed format. Review of report by ICMR, result of report, and the stipend dispatch, and the last thing will be the e-certificate dispatch. So this will be your timeline starting from registration till you get the certificate. So online registration, it has been a change procedure since last 1 year. You have to click in the link to fill the login detail, students course detail, and students person. So how you have to do? So once you register, you get a password and reference ID, for example, 2024 XXX. You are not supposed to tell your name. You will be corresponding by this ID only, and login ID will be your email. So remember, don't confuse between login ID and reference ID. Login ID will be your registered email. Reference ID will be the number allotted to you by the ICMR. Student will require this reference ID and email at the time of report submission of project letter. Therefore, you note down this carefully and do share this with your guide. So these are the steps of registration. Step 1 is to click this link of DHR, that is Department of Health Research. And on the home page, here you will find the DHR EPMS login. That you have to click. You click on register. If you are a new user, which you all are, once you will click, you have to apply over here, register, new registration. And then you have to fill in the details, your name, email, mobile number, password, confirm password, enter the CAPTCHA, and then you register. Once you give all these details, once register, you will be landing on the dashboard page. You have to click on verify email and go to your registered email ID. Open the email and click to verify the email ID like this. Okay, activate your email address and then we'll confirm your registration. Once your email is verified, dashboard will look like this. For DHR EPMS, and here you have to click on this proposal submission. You have to click on the proposal submission, and then you have to click on HRD, proposal submission, HRD, and then once you open this, the first will be the STS, okay, and you have to click on this apply. Once you click on this apply, you will get this page with these 4 things to be filled. Remember, here your reference ID will be given in this blue letter, okay, and only then you can fill all these 4 parts A, B, C, D. Part A is pertaining to your student's detail, part B, guide detail, part C, attachment, and part D, proposal. So I will briefly tell about all this. So starting with part A. Okay, so part A is registration detail once again. So it will have registration email ID, mobile number, alternate email ID, all the details, your name, course, year, everything, your college details, all this you are supposed to fill in. Okay, alternate mobile number you can give of your guide. So there is no missing of any important call. And alternate email ID, you can also give email ID alternate of your guide only. Okay, part A. Part B is pertaining to guide. Before you fill the form, get all this detail from your PG guide or project guide, his name, designation, department, okay, address, mobile number, and everything, okay, and his email address, whatever is being used. So part B is detail of guide. Okay, and part C, this is pertaining to the attachment. These are the 6 possible attachment, out of which the application attestation form, AAF, and the ethical committee approval form, these 2 are mandatory. All these remaining are not mandatory. I will explain what this application attestation form and ethics committee approval form is. So this is how it looks. You have to choose the file and you have to fill these 2. If you have informed consent form, case study form, study questionnaire, that you can also perform. Okay, and the size of file should be less than 1 MB. It should be in PDF only. Okay, and then you have to tell the detail of your part D will be about your proposal, the title, type, subject area, which department you are going to do this thing, and the research proposal, okay, without any identification of yours. Title, type of study, subject area, department name, and research proposal. Okay, this is the application attestation form. The blank form is available on the STS website. You have to attach the photo, you have to fill in all the details, and you need 4 signature: signature of student, signature of guide, signature of head of department, and of dean of your college. This 4 signature, and then you have to scan and you have to attach this application attestation form. This is IRB certificate. Each college runs institutional review board, so you have to get approval from the IRB. And if it is not available, you can get the undertaking that it will be approved later on. IRB certificate. This is a case record form, which is not mandatory, but you can make beforehand. Case record form, informed consent form, the information to the participant to get permission. Okay, and now research proposal, I think this part will be taken by Dr. Parag Chavda. Okay, so I will not go into detail about it. Okay, so important thing at the end to note that the proposal or project should not have any identifying information of the student or guide. Okay, so the reviewer has unbiased review. Name of student and guide should not be given. Address or contact detail, even the name of your college should not be given. Telephone number, email ID, all these things should not be there in your any of the document like proposal or report. Okay, this type of studies, I think Dr. Parag will tell you, subject area also. Okay, and what are the benefit of doing this project to student? This will give student a research experience. ICMR certificate is one of the most certificate with weight of your ability. Stipend rupees 60,000. It is a good co-curricular activity which can help in your study. Student can learn the soft skills while doing the project. It will make your CV strong if you want to apply as a foreign postgraduate in future. Who knows, you may have a career in research also, and when you learn something, this knowledge will be beneficial in your PG thesis also, if you know something about research. Benefit to guide certificate will be having name of the guide. it will be counted as a funded research of the guide. Young teacher like me who don't have PG student, they can use UG student as a research partner. Okay, it may be a project bank of your department. You can build your own research ability. You can justify R of research in your appointment. It may help in promotion, publication, and more visibility among peers. So it is having benefit to both students as well as guide. Okay, there are two forms to be attached. So people sometimes confuse between these two. One is a AAF, application attestation form. Okay, this is at the time of submission of proposal. Okay, AAF, which has students, guide, head, and dean for signature. But once you finish everything, at the time of final report submission, after end of 3 years, we have to attach RAF, that is report attestation form, which only has signature of student and guide. So do not confuse between these AAF and RAF. Okay, so this is all I wanted to tell you about ICMR STS, how to go on. And now it is over to Dr. Parag Chavda, who will tell about how to make proposal and which topic to choose and what are the norms to make the research proposal. Over to you, Parag bhai.
Thank you, Jayesh bhai. I'll share my slides. Jayesh bhai, you'll have to stop sharing.
Stop sharing my screen. Stop sharing. Okay.
Okay, thank you. Okay. Jayesh bhai, slide is visible?
Yes, sir. Visible, visible.
Okay, thank you. So, thank you, Jayesh sir, for taking us through the entire process so meticulously well. And within that short time, Jayesh sir has took us through the process of application of ICMR STS. That brings us a lot of clarity about how to navigate the ICMR STS application submission platform. Now I will be in next 15 or 20 minutes. I will be talking a little bit about the STS proposal writing and a little bit of guidance notes over different sections of the ICMR STS proposal that the right. So these are the four parts. And as Jayesh sir mentioned, that part A and B are something where the students and guides information is noted. And part C and D are something which are more technical, and hence the identifying details, neither names or anything else, is not expected. So in the enclosures and research proposals that you upload as one of the files, no identifying details of even the college should be there. We'll move further in the research proposal. So this is an overview, a layout of how the research proposal would look like. Your research proposal would be in Microsoft Word document running across multiple pages, maybe a 5-page or 6-page or 7-page document, and it would have these many sections. So I would, the students attending this, I would want the students to look at the number of words which are usually suggested for each of those sections. So what we take away from this slide is that higher number of words are expected in methodology and some words are also allowed in introduction, which means that uh, the STS proposal expects you to be writing more about what you want to do rather than you summarizing what others have done before you took up this research project, right? So more words on methodology and less words on introduction. And the rest of the words we are going to talk about as we talk about each section one by one. We'll start with the reference ID. So reference ID is the ID given by ICMR SCS portal, as Jayesh sir mentioned just now. It would look something like this and followed by title and introduction. But when you do that in your Word document, which is the STS proposal, please mention only the reference ID and ensure that you do not write your name or name of guide or even the name of institute anywhere in the proposal. So when you refer to your medical college, you can refer to it as saying that this is one of the medical colleges, let's say in Western India. So that would suffice, right? We move to the next part, which is title of the project. Now, when your ICMR STS proposal would be going to the reviewer, your title would be the first phase of your proposal, which the reviewer reads. So your title has to be not only catchy, but also needs to provide sufficient information about your study. So what your title can possibly include a lot of things, but ensure that you mention you ensure that these three things are reflected in your title. One is the study population on which your study is done. So whether your study is done among let's say nurses, or your study is done among people living with HIV, or whether your study is done among the schools, and mention your study variable. So what exactly are you planning to do? What information are you planning to collect? And a little bit information about the study design. So for STS proposals, most of the studies happen to be cross-sectional kind of a study. So if that is the case, or if anything else is the case, you can mention. So ensure that the word count is 25 words. So apart from putting your title in the Word document at the start of your Word document, you will also be required to put it in the portal itself within the designated field. So that field would not take more than 25 words. So ensure when you write it, you summarize it in within 25 words. Followed by introduction. Now, usually 300 words or less, and a leeway of 100 more words is given. Now, this does not mean that you have been given 400 words and you have to utilize all 400 words. If your proposal finishes in 265 words, that's perfectly fine. If you feel that whatever you wanted to convey around the topic, you have conveyed, that's perfectly fine. So you, in introduction, I would not suggest you to stretch up to 300 or 400 words. Lesser the better, but reasonably ensure that you have been able to uh, share the background information about your study with the reviewer who reads your proposal for approval. So keep it shorter, add references where appropriate, so you are strengthening or validating whatever you are reporting there. Split the content using appropriate paragraphs. uh, and what you could write, the flow of the introduction section is shown on the right side on this slide, where you could have, so say for example, you could have it at least in 4 paragraphs, if not less. Introduce the topic in general, and then the three other things: what is already known about the topic, what is the lacuna in existing knowledge around that particular topic, and there could be many lacuna in the existing knowledge around that particular topic. You would be choosing to study only one small part of that lacuna. So remember that in STS research, when you do the topic selection, the purpose is not that you come out with a path-breaking or groundbreaking research. The purpose is all of us understand, whether we are the faculty members or the ICMR scientists who would be reviewing your proposal, they understand that this is probably the first research that the student undertakes in his medical career. And hence, what large purpose is that the student understands the research methodology by participating in a small scale research study. So it's not expected to be very novel or very path breaking kind of a thing. It is expected to be something very simple. So the purpose is not to come out with very extra novel findings, but the purpose is to have the student undergo a process and have the student experience the research process. So you will be picking up only very small part of the lacuna which you want to study in this particular effort. Now, your effort does not end here. You might consider this as one of the pilot researches. STS might be one of the pilot researches for a big research that the student might wish to undertake later on in life, right? So, and then as part of this, you might also be what is already known about the topic and what is the lacuna around the topic. You would probably be referring other people doing research on similar areas. Now, when you do that, you are expected to paraphrase, which means that you are expected to summarize their findings in your own words, right? So you need not copy paste the entire thing, the entire words in the result section of the previous researchers, right? So that's what you are expected to write in introduction. Moving to the study objectives, lesser the better. But if you are dealing with more than one objective, please ensure that you identify one of them as your primary research objective and the rest would be the secondary objectives. Your sample size would be determined by your primary research objective. And although 100 words is given here, but you need not stretch to 100 words. So whatever, so words don't matter here. It is just that they have mentioned that do not write the object. Your objectives are very specific statements about what your research would end up, the question that your research work would answer, right? So there are many formats. PICO is one of the formats. So I've given just two research questions here, two different research questions here. You can uh, uh, consider them as primary objectives to estimate the mean time taken for healing of a diabetic foot. So understand how specific and focused it is. I'm not suggesting you to take up this topic, but just giving one samples to highlight that how focused it could be. So this could be a study done over 50 diabetic patients admitted to surgery department in the hospital, which is attached to your medical college. Or it could be something like to compare the incidence of back pain between heavy and lightweight school bag users in one or two of the schools which are nearby uh, for your medical college. So it could be this specific and focused. You will not be expected to be answering a lot of questions or doing something very big at the end of STS project. You would be very focused and be able to tell at the end of the project a very small fact, but very confidently be able to tell so. So that is about the objectives. Now coming to methodology. Now this would be very detailed. This could be as detailed as that someone else wishes to reproduce the study as you did it. The person should not have to consult you or call you or ask you as to how do you plan to do that. So it should be that meticulous, specifying every detail. So a lot of word space is given there. Two specific things at the beginning. One is type of study and study design. So type of study are these many are the type of studies. So in the clinical environment, you might be doing some clinical investigation. So you might be, say for example, trying to find out the risk factors of some diseases, or you might be interested in some therapy or management which is already ongoing. But remember that you are not allowed to do any clinical trial as part of the STS. Or your research might be epidemiological investigation, where you might be trying to find out a risk factor for a particular disease by going into the field and collecting your data within the field. Or it could be a field operational research, where you are trying to find out within a systems solution to any particular systems issue. Or it could be health education and trying to find out whether it is effective or not, or some laboratory investigations. Product development, very less number of students take up, but that's innovation. And if you wish to create a product or service something new, and if wish to say for example validate the results of your product, or validate whether your product is effective or whether it has some utility to its users, you can put it in ICMR STS as well, or it could be something else as well. With regard to study designs, there are three common designs. One is a descriptive design, second one is an analytical, and the third one is an interventional design. So a descriptive and analytical is allowed in STS, interventional is not allowed. So next is the study population that we discussed in the title. Apart from study population, sample size and sample selection criteria are also needs to be discussed in more in detail. So you can get a lot of more guidance around the topics. There are a lot of webinars available on YouTube. You can also check on our own YouTube channel, on which this particular webinar would be which would be recorded. So there also you will get a lot of guidance there about how to calculate sample size and what to write about selection criteria. The third thing is about study variables. What exactly do you wish to measure on your selected sample? So this would involve a case study form. So it would usually be better that if you can supply a small case study form or case record form at the end of your project proposal. And as Jayesh sir mentioned, that there is also a separate space to upload that in the portal itself. In the methodology, you are expected to write the data collection process. So exactly how will you start with the first patient, and how the consent would be taken, and how the entire process would go on. A little bit about quality control. So depending on the study design, you will find the checklist for quality control of that particular study designs. So you can utilize that checklist and ensure that what all quality steps measures that you have ensured in the proposal writing. Plan of data analysis, you need not write too much in detail, but you should be sure if your research question is very focused, you will be able to tell that. So, for example, in the previous questions, it was mean time taken for healing of a diabetic foot ulcer. So in the analysis, you would be able to say that you'll be explaining your result in terms of mean and standard deviation, right? Or if you are comparing two groups, you should be able to share here whether you will be applying t-test or chi-square test to analyze your findings. So that much just would be enough, because you do not have the data collection and findings as yet. About ethical considerations, we'll be coming in on the next slide. Type of study we have seen, there are a lot of subject areas. So as Jayesh sir mentioned, those that drop down field, from that field, so many subject areas would open up. So you can look at them and decide which one excites you. About ethical considerations, as Jayesh sir mentioned, that ethics approval at present state, when you are submitting your proposal, is not compulsory. So if you have already taken the ethics approval, you can upload the ethics approval letter. But if not, you can just upload an undertaking where you say, and that undertaking, we do not have a sample for that undertaking. That undertaking would be just one or two words where you and your guide signs, and that's an undertaking where you state that uh, the title of the study, and then you are stating that for this particular study, you are under preparation for the participant information sheet, and you will take care of all the aspects related to ethics aspects related to human research, and you will abide by all the guidelines, and you undertake that before starting the data collection, you will be taking approval of the human ethics committee of the respective institute. So those 2-3 lines of such an undertaking would suffice. Now, in the proposal, there is a section where you talk about ethics that you will take care in your study, and that mainly what you state is that confidentiality of the participant, your research participants, will be taken care. So you will not be disclosing the identity of that to anybody else except who are part of the research team. So part of the research team are limited. You and other students might be there. A limited number or 2-3 students might be part of your research guide, and maybe other faculty members, or in the say for example, someone who helps you in analysis of your data finding. So beyond that, there is confidentiality. And it would always be better to put a participant information sheet, which would be in English and the vernacular language, where to your research participants, you are explaining to them what is the purpose of research, what exactly is the research participant expected to do. Are you going to meet them once, twice, or more than once to collect data in vernacular language, and then what data you are expected to collect from the patients, and what would be the benefits to the participants or society in general, and if there are any risks as such of participating in your research proposal. Most of the student research projects are in the category where they involve less than minimal risk to the research participants, or if at all, it would involve usually minimal risk to the participants. The STS proposal expects you to be writing some implications also, and this some students find it little difficult to write. So what you are expected to write in implications is this is maximum 100 words. You need not stretch to 100 words. So what you are expected to write is utility of this research. So once assume that you are in a future state after 2 years of completing your research, and what can anybody in the world do with your research findings. So the first person to utilize your own research could be you yourself, where you say that this I took as one of the pilot studies, and based on my findings, I have identified these future directions. So I might, if I'm interested, I might be continuing that research in one of the particular areas of future directions that I identify. Patients, which means family members or caregivers, might be utilizing that. Health professionals, which means doctors, nursing, and allied, how the information that you come out with, how that might be utilizable to different people. So if you are doing a hospital study, the information that you come out with might be utilizable for hospital administrator, or how that information might be utilizable by the government or society at large. So the research work, the disease on which you are doing the research, there might be a patient support group or patient interest group. So someone doing research on hemophilia, there might be a hemophilia society which is run by patients themselves. So your findings might be useful to them. If you are doing research on elderly, old age home people, might have some utility of your research, right? Or if your research is within the schools, your findings might be utilizable to school teachers and school administrations, something of that sort. So that's and there is no as such pressure to write implications, you can write it openly as to how different people or different stakeholders can potentially utilize your findings. The purpose of writing implementation, the purpose of expecting implications in the proposal itself is so that the student is aware that the student does a research which has some utility to the society. The research is relevant to the current needs and the current problems which the society faces. So for us students to think that we do relevant research, that's the only purpose of implication sections. Otherwise, your reviewers would not be too stringent about the implications. They would be much more stringent about the methodology, though. References, uh, uh, although the words is 300, you need not stretch it to 300 words. Somewhere around 10 to 15 references would suffice. So why references? To acknowledge the contribution of previous researchers, reflects your meticulous review of literature. So and helps reader to retrieve the cited articles. So whatever you cite as a reference, expect that your reviewer might cross-check one of the references and identify what you are quoting somebody else's research, saying that this particular sentence is supported by that research article. Your reviewer actually go back to that article and find out whether that article talks around that particular topic. So your introduction in methodology, introductions would have more references, methodology might have less. Disease prevalence and previous similar articles you might wish to refer in the introduction. In the methodologies, if example, if you are using a questionnaire which was validated by somebody else, that reference needs to be cited. If you are doing something where an operational definition was used, uh, that needs to be cited. If you would have usually used one or the other sample size calculator, so that should be referred. Take peer-reviewed journal articles preferably, avoid newspapers, blogs, and Wikipedia, and try to keep the references little recent. So that would mean that you have gone through the recent literature around the topic. So that's the last slide where we talk about some general tips. So since we are at the proposal stage, you will be writing in future tense. So instead of patients were interviewed, so sometimes this happens when you are copy pasting from previous articles, and articles are written, manuscripts or scientific articles are written in past where they already done the study. So they'll be written in past, but you are writing a proposal, so that has to be in future. Writing in third person is allowed. Once you write and before you submit to ICMR, get it uh, thoroughly reviewed through guide one of your classmates and one of the language experts. So any of your friend who has a little good authority and grip over the English language, so please pass it through them so that your proposal looks better. And keep the font size 12. You can keep sufficient and good and uniform margins, and a style which is not very informal. So font style should be something which looks a little more formal. Ensure identity is not revealed. In the different sections we have already mentioned, I'll just summarize in one sentence about each. Introduction has to be brief, shorter than methodology, but provides a very good grounding. Objectives are very specific, focused, lesser the better. Methodology is very detailed. Implications, a brief idea as to how your research is utilizable to society, and references is an indicator of how meticulous you have been about your review of literature. So this is what I wanted to share a little bit about the proposal writing. That's it from my side. We are open to questions now.
We can look through the chat box and we can just answer some of the queries raised. So one query is third year student. I think in last year, if I'm right, correct me, Parag bhai, third and fourth year students were allowed in last year, 2024. But I think in this year, it is so far only for the first and second year students only.
So last year also, as only the interim measure, it was allowed, and that was probably the last incidence. Or do not expect that ICMR is going to give any leeway for third year students currently. I don't think third year BDS would also be allowed. I'll just go through. There is a request for the PPTs. I assume that this session is going to be available later on YouTube. So you will be able to have a chance to look across once again to the session as well. Uh, there is also a small WhatsApp group for those who are interested in ICMR STS. I'll request if that's possible, and if Chinmay sir is around, maybe we can share it here. If any blood sample is
intervention studies are not allowed, but yes, blood sample, if it is required, if it is a part of requirement of study, so you can take the blood sample, but you cannot try something new. It should not fill in that lacunae of clinical trial.
So, with regard to, as Jayesh sir mentioned, that with regard to blood sample, it is for sure allowed, but just check with the guide about the feasibility of collecting blood samples from the patients. Blood sample collection would be minimal risk, so that should be allowed. With regard to quality control, so quality control is a less talked about area in research proposal and research reporting. So what we write, say for example, there are many checklists available for peer review of research articles depending on the study design. So there is a STROB checklist and so many other. So there is a website which is called as Equator Network. So Equator Network gives you a very good collection of all the checklists around that particular research design. So you can find a relevant checklist for the study type or study design that you have employed. So Equator Network, you will find something on cross-sectional study, and that you can use as a checklist to try and reflect in your research proposal that you have taken care of so many different aspects of quality, starting from keeping your research question focused to making your methodology more meticulous and so on. So after those, since
yes, last date is 31st May. 31st May is the last date, so only few days are remaining.
I don't think one question is on in vitro studies, and I don't see any reason why they should not be allowed. So they should be allowed. In vitro studies should be fine.
Clinical side projects are not accepted. It is not so, sir, because out of my 12 projects, 9 were pertaining to medicine or obs gynae. So it is not so. The bottom line is that in ICMR STS, they don't give the do's and don'ts. So whatever proposal you make, we don't know what aspect they will like to accept, and they will like, it's a sort of randomization. So maybe some simple studies you may think they are accepted and you make the best possible, and it may not be accepted. So don't be disheartened, that you can try for some other project also.
The clinical side, why the projects get rejected, may I know? And actually, the rejected proposals, if they make one column and give what was the lacunae, we can correct next time. They give only accepted numbers, only rejected, they won't give any explanation.
That is the biggest burning question I am also having, because my initial few topics now, they were pertaining to disease in medicine. But I know since like 2-3 years now, what they may be thinking that this is a topic where intervention and therapy is evaluated. So how a first or second year student can be, but in rather that way, we can shift it from treatment to diagnosis sort of scenario. So for example, ECG changes in XYZ disease, so that the first or second year student can easily learn. But when you add some intervention or therapy sort of thing now, maybe this is what they are taking as a measure to reject. And yes, they never write the reasons behind anything being accepted or rejected. So it
yes,
is up to them.
Yes, yes.
Only up to them, sir.
Thank you, thanks.
I'll try and understand the reasons for refusal or rejection of proposals. I feel that since a lot of ICMR STS scientists are employed as the reviewer pool, a large part of them would probably look at whether the research proposal is something which is a relevant question. So whether it's a problem which is commonly encountered in India. Second part, I'll say that the four important things to see whether what are the chances of your proposal getting accepted, whether the problem that we have talked about in the research title, whether it is relevant. Second one is whether it is novel. By novel, I don't mean that it's very groundbreaking, but it's not something which is a Me Too study that already 200 such publications are already done. Say, for example, internet addiction among medical students. So that would not be called as novel. Third is focused. So if the research question is very vague, the scientist would say that probably nothing significant is going to come out of it. And fourth one is whether to the scientist this looks feasible to be conducted by a first year student or a second year student. So these four, I would say, whether it is relevant, I mean, how good it scores in terms of whether it is relevant, novel, focused, and feasible. So if we can, we probably do a kind of a Likert scale on and give 5 stars. For my own proposal, out of these four, probably we'll be able to do a self check. And probably another area would be give it to a peer, a specialist who is trustworthy from the same specialty, and ask to rate. Probably we'll be able to give some feedback to improvise the proposal so that it gets accepted.
Thank you.
For informed consent.
There is also another side of the story that ICMR has to give these many studentships every year. So in some specialities, although the scientists might feel that I would not really wish to accept this, it gets accepted. So that's also another side of the story.
I forgot to mention that the period of this STS project will be from 2025 to 2028. So first is 2 months at the summer break of 2025, second 2026, and third 2027. And the final approval and e-certificate and stipend that will come in 2028. So 25, 26, 27, that are the 3 summer breaks for working. And by the end of 2028, the report and everything will be finalized. So it will be a 4-year long journey from now on.
Okay. There is one question on, I guess there was one on randomization in clinical trials. And since clinical trials are not expected, any details on the randomization is not expected in STS proposals. There are a lot of questions.
Which field is more likely to be selected? So I think there is a saying in Sanskrit, na, tunde tunde matir binna. So we cannot pinpoint that this will be going to be accepted. So it depends on what they feel. But as Parag sir said, now you keep in mind what things they wish in a proposal of MBBS student who is just novice for research, working under and guide.
Jayesh sir, there is one question about the timeline, and you shared one timeline figure with us. If that's available, we can display it here.
I will share this in WhatsApp group. I think the timeline, as I said, now the 2025
also,
summer break, it is for the proposal making. 2026 summer break 2 months for the interim report making, and 2027 summer break for the final report making. And then it will be evaluated, and by 2028, they will dispatch the stipend and final approval and certificate.
I'll request the eco representative if I can be made host, so I can upload that here.
नीरज भाई पराग सर ने होस्ट बनाओ.
Thank you, Chinmay sir. Chinmay sir, on what YouTube channel the recording would go? So I've given the YouTube channel of MEU. Kindly just check whether it is appropriate.
Yes, it is appropriate, and I have also shared one WhatsApp group link just now, so everyone can join that WhatsApp link. So even if it is on the another link, we will share the YouTube video. And I don't know we have discussed it or not, but this time the number of seats will increase. Everywhere it is 1,500, 3,300 are BDS and 1,200 are MBBS. But this time it may go to 1,500 MBBS and 500 BDS. So it is expected to increase from 1,500 to total 2,000. And secondly, there is one question regarding which are the component, which type of study will be approved. So in one of the informal discussion, it was discussed that the study which will make some impact will be approved. एक ही चीज केपी स्टडी है, छोटा सा ऐसा हम, क्योंकि हमको तो कुछ भी थॉट आते हैं. Is it going to have an impact in public? That type of research will be accepted more.
Okay. One more question is how many minimum references are required? There is no as such guideline on the number of references are required. Let's say even if they are 5 or 7, that should also be fine. What references mean is that you have sufficiently gone across to the literature, or for sure you should be able to find out 5 or 7 references for the research proposal.
Yes, RCT are accepted.
Acha, there is one question whether if you have not ethics. So what sir mentioned was the ethics, some document around ethics needs to be uploaded. So if you do not have the ethics approval letter, you have to upload the undertaking. So once you have uploaded the undertaking, that's perfectly fine. So what is mandatory is that either you upload the approval letter or you upload the undertaking. So both of them is fine. And if you have not got the ethics approval as yet, it does not in any way reduce your chances of selection. But if you wish to increase the chances of selection, ensure that ethics approval is not in your hands, but writing a detailed and meticulous plan of how do you wish to handle ethics in your project is within your hands. So if you how meticulous is your participant information sheet in English and vernacular language, that is within your hands. So that would determine the chances of whether selection or rejection.
Our educational intervention allowed, so yes, it is not a clinical intervention invasive study. So you can have the pre versus post sort of educational intervention study, provided the guide is well versed with doing those sorts of MEU based studies.
With regard to the question on third year students, so ICMR ICMR per se does not have any program as such for studentship with regard to research for third year students or otherwise. But once you complete MBBS, there are a lot of schemes of ICMR where you can go for junior research fellowship, senior research fellowship. There are a lot of schemes for supporting postgraduate dissertations, and of course you can potentially go for a full-time career as one of the scientists. So that's is always open. Uh, and some institutes also do have their own say, so what do we really mean by ICMR STS is that the only additional thing with ICMR STS is that they're giving you a certificate and some amount of money as a stipend. Does not mean that the third year students who are in third part 1 or third part 2, whether in MBBS or BDS, are not allowed to do research. So please understand that ICMR STS is just one of the motivations for doing research. A certificate and 60,000 rupees is not the only motivation for research. So you are not only allowed, you are in fact motivated to do research beyond ICMR STS as well. So whether the college is giving you some kind of a stipend or not, if you are interested, you should always be motivated. Find out a guide with whom you are comfortable and always do research. The faculty members would be happy, your institutions would be happy.
Difference between clinical and lab investigation. So sometimes it may be combined. So for example, you are measuring blood pressure or ECG. So that is a clinical investigation. But if the sample is taken to a particular lab, so it is a lab investigation. So I think you better don't get confused. But whatever you take, that must be justified ethically. That must not have any ethical issue with reference to research, because for research, you have to follow the good clinical practice, and ethical concern must be discussed with guide. Okay, first. So students have all the ideas, but whether they are ethically right, whether they are relevant, for that only we are having guide for this STS project.
The next question is whether sign is needed from every single patient whose data is utilized. So usually it involves two kind of research. One is primary data collection, secondary. Secondary is where the data is already collected in the patient's documents, say OPD papers or indoor case sheets, and you get it from medical records department where you might not be able to meet the patient per se. So where you will take all the necessary permissions. When you are doing the data collection primary upfront and meeting the patient, yes, for sure you will need to take the patient signature to say that you have sufficiently informed the patient about all everything that the patient needs about participating research. So patient's autonomy is very important. Patient voluntarily decides to participate in your research. And so to signature is just probably an evidence that you have explained it everything to the patient, right? The for time period, I'll just probably say that in somewhere around May 2025, you will be writing proposal. In May 26, you will probably be submitting the interim report, and somewhere in 27, you will be giving us the final report.
Yes, you can.
Any other faculties here joining can share their thoughts? You can see many other faculties. We and Parag Bhai are two juniors, so whatever we know about research, we just share our knowledge. This is how we learn, give and take.
I see Sanjay Bedi sir is here.
Bedi sir, I am seeing.
During the session, and it is really good that the amount and numbers have been increased drastically, and it will make a big change in this ICMR STS project. I have personally guided 8 projects so far when I was in my when I was younger, and so. But the key thing remains is teaching undergraduate students about research methodology. Otherwise, it comes totally, the project comes totally on the guide to do almost everything.
Yes.
So the key, it's my reflection is that the MEU should, those who are selected, at least for them, there should be some classes on research methodology, that how to collect data, some statistical analysis. That is very important.
That's true. But what I observe is that sometimes the undergraduate students, they are more enthusiastic about research than the postgraduate students. Especially many of them want to go abroad. So you are right, sir. Guides' responsibility will be too much, but this is how it goes. This is how it goes.
The objective of these is that the undergraduates should learn about research methodology.
Yes.
So, if they are taught first how to do it, that is, I remember there used to be one organization which used to come to colleges to teach only on STS projects. It used to, from college to college, it used to go. And it was from some retired professor who had created it. He was from Nagpur. I've forgotten his name. But he had created a team, and they used to, in all regions of the country, they used to come and they used to conduct workshops on research methodology for undergraduate, those students who have been selected. And they used to make in every region, they used to, 10 colleges or 20 colleges, they used to bring together. So those initiatives have now, I have not heard of them again, but in around 10-15 years ago, there was an organization which was working only on teaching STS students.
Thank you, sir, for sharing those thoughts. We will surely plan something from the Directorate of Health office in Gujarat. I'll take few more questions. One student is asking if the student is in current first MBBS, when should they be submitting the proposal? So ICMR runs in cycles, and the current cycle, the proposal submission last date is 31st of May, so which is 11 days from today. So the first year student would also be submitting on 31st of May 2025.
For all the updates, now you have to keep looking at the website, because whatever changes are there with respect to date or anything, whatever I am saying over here, it is just a rough timeline. But exact month and exact date, whether it is extended or postponed, so that you have to keep following that website. Previously, it was only the ICMR STS website, so it was very easy. But now the DHR website has so many other things also. So in the latest news update, you keep on seeing once your project is selected for all those updates. Zone-wise representation, so we are not in a position to say, because each proposal has equal chance of being selected. So you just back yourself that you are doing the best and you can be selected. That's it.
Once again, a lot of questions are on randomization. Please understand that we use randomization only in interventional studies, and except for the interventions very small and simple, such as health education session to let's say school students, that is allowed. Any clinical intervention in terms of a new drug or new therapy, a new way of treating the patient or preventing disease in the patient, would usually fall outside the purview of STS, and hence there is no question of randomization. There is also a question on randomized case control study. So I'll request the student to please read about the different study designs. It's also covered under the, you'll be able to find about it more in any of the community medicine textbooks. So I am yet to come across any such study which is randomized case control study. So usually randomization would not be employed in a case control study.
One question is, for application process, patient consent form is not required. Remember, in patient consent form, you have just to submit the rough draft. It is just a blank pro forma, which is not having any details. Okay. And even the ICMR will not ask you details of each and every person. Okay. But still, you must have everything. So you have to just attach the blank pro forma, and it is optional thing. Case record form, questionnaire, it is informed consent form. All those are optional things. But yes, you must have this, because as per GCP, good clinical practice, when you conduct the research, all these things are required. You have to give patient information sheet, the details to the patient. Then you have to take the written informed consent, and you have to maintain all these documents. It is part of surveillance of IRB committee, which is there in each and every institute.
There was one more question about when data collection needs to happen. So it is just what ICMR mentioned is just suggestive. So it is for primarily for the purpose is for disbursement of the stipend amount. So ICMR does not prevent the student to do data collection anytime in between. So it is just to allocate that for some days of work the student is given stipend. So there is a 2 year time period where in the interim period, somewhere after 1 and 1 and or 1.5 years, or let's say 12 months, or after 15 months, some interim report would be asked where your data analysis would not be expected. That's the status, whether you have obtained the ethics permission, whether you have already started doing data collection or not. Only that interim report would be expected. So I understand that data collection would be allowed throughout the period of 2 years, in a way that you should be able to write something about the data collection progress in the interim report, and you would be able to give the complete analysis along with the report by the end of those 2 years.
I think no more questions are left, and Chinmay sir has already shared the video link, I guess, and also for the link to join the WhatsApp group. We and Parag, Dr. Parag and Dr. Chinmay sir, we all try to help. Research is a sort of cohesive work. Whatever we know, we can share with each other and we can progress further. Okay.
Okay.
So I think Dr. Chinmay sir is busy with some other work. So on his behalf, I thank the host, I thank the Prime Webinar Series, and I also thank Dr. Parag Bhai. And on my behalf, I just wish best luck to all the students, it is not just for the first research. I think in many courses like nursing and dental, in final year they have a topic of a subject of research. But in medical field, I don't know why we just neglect the research. So we hope that it goes better with time to come. Any other faculties, if they want to share anything, then they can.
I see Vaishali madam.
Dr. Vaishali madam, I can see.
Vaishali madam, would you wish to contribute anything? Okay, okay. So with that, then I thank the Department of Health Research, Government of Gujarat, Dr. Chinmay sir, Jasmin sir, Jayesh sir, and Eco India team for the webinar. Thank you once again to all the students and the faculty members for attending. Best wishes. Thank you, Jayesh bhai.
Once again, best wishes to all and thank you to all once again.